other thing first. There's one other
Okay.
skin abnormality that I want to show that is important for people to understand, because a lot of people have skin that have spent many years
Ah,
in the sun and have a lot of bad sun damage in their skin. And
yep.
that creates a variety of problems. For one thing, a lot of melanomas, not all of them, but many melanomas are in some way related to ultraviolet radiation and sun damage, as are basal cell carcinomas and squamous cell carcinomas and a variety of other skin cancers. Also, the wrinkles that we see in the kind of leathery skin when you've had skin that's been exposed to sun for many years. All of that stuff comes into play when we are looking at skin that's been exposed to sun and we're looking for melanoma or other cancers. So I want to show you that you've seen normal skin now. This is abnormal skin, although I see this kind of skin so often that it's almost like a different type of normal. For older folks who have been out in the sun for many, many years, this is what their normal skin looks like oftentimes. See this gray blue stuff? This is not normal, right? I just showed you over here, the normal dermis is supposed to be nice, bright pink collagen. But what has happened is with many years of sun exposure, the collagen, it's still there a little bit, but it's been replaced by this thick layer of what we call solar elastosis. These are abnormal elastic fibers that have built up here and replaced the dermis, pushed that collagen down. The overlying epidermis is kind of thin. It's not very happy. So, we all like to be out in the sun, but it is good to try to protect our skin from the sun as much as possible, because over many years, this kind of damage is not totally repairable. You can do some different things to try to make it a little better, but you're never going to totally take this away once you've gotten a lot of sun damage accumulated. This person was probably 70 or 80 years old and has had obviously lots of sun damage, but I just thought it was worth seeing that this is what chronic sun damage does to your skin. So when your dermatologist is telling you, this will mess with your skin, they're not lying to you. I see the effects of it every single day in my job as a dermatopathologist.
I wish I had like a normal skin and a clinical photo of a normal skin of a young person and an elderly patient of solar elastosis look like that can match with your pathology. That would be
We
great.
should get that together. You can get a picture of each, and I can get a path of each, and we can make a little 2x2 panel to show, because I think that would be really valuable for people to visualize like what's happening both
Yeah,
clinically under the microscope. Is more than just you got a sunburn. It's over the years, this stuff really adds up. And the results that we see, both you clinically and me on the pathology side, we see some really terrible things that happen from overexposure to sun, unfortunately.
totally agree. All right, what's next?